Hello, my name is Mansoor Shefkat. I'm a health educator with the University of New England, and I'd like to welcome the members of Bill and Melinda Gates Foundation to the case study presentation on suicide rates among young girls within the U.S., which has become one of the leading issues on maternal and child health. It is a concerning public health matter and one that deserves a lot of attention, where the suicide rate among teenage girls continues to rise and has hit a 40-year high recently in 2015. The population includes adolescent girls between the ages of 10 and 14 in particular, but also includes girls ages 15 to 19. Although young girls are being impacted by suicide throughout the country, the states with the highest suicide rates include Alaska, Montana, and New Mexico. Population seems to be most impacted by suicide during the onset of puberty, and a contributing factor definitely is a mental health issues such as anxiety and depression, but also cyberbullying, family issues, exposure to violence, and economic burdens. When we look at the social ecological model, at the individual level, a promoting factor for the individual level is the individual's cultural or religious belief that discourages them from suicide and support instincts for self-preservation. However, on the other hand, a hindering factor is mental illness or substance abuse history. At the interpersonal level, a promoting factor is supportive relationship with healthcare providers, and a hindering factor is family history of suicide. When we look at the organizational level, a promoting factor is having healthcare insurance plan to seek mental health care, and a hindering factor is no available school psychologists or counselors. And when we look at the community level, a promoting factor within the social ecological model is effective suicide prevention media campaigns, providing information on helplines, whereas a hindering factor is no community advocacy group in places for combating efforts in preventing suicide. And finally, at the policy level, a promoting factor is federal policies in place requiring support for mental health screenings and providing resources to the state level in effectively combating suicide. Whereas a hindering factor is no effective interventions in place by the state laws requiring schools to conduct mental health screenings for students that are at a high risk of depression or with previous suicide attempt history. So, what are the proposed interventions or evidence-based interventions that we can have in place to prevent suicides among young girls? Well, one of them is having an established 24/7 suicide prevention lifeline. This will be an open line of communication established, which will play a vital role in ensuring that there will always be someone present to listen and talk to the young girls in time of crisis. This lifeline will provide confidential support to the young girls and will act as a bridge to connect them to mental or medical resources available to them within their area. The suicide prevention lifeline will be promoted in their local schools so they know how to access the support system either via phone call or through the internet. A second proposed intervention is providing annual mandatory training to all school personnel that are in contact with the students to ensure that they are aware of the signs which are presented among the youth who have suicidal thoughts. This resource will help school personnel identify young girls who are in danger of harming themselves by noticing their body language, performance in school, and overall demeanor. This training would also allow the staff to identify, prevent, and intervene on this growing public health matter. This training is going to be a great resource in educating the staff on what their individual roles are pertaining to the issue of suicide. And finally, the third intervention is using a collaborative care approach. No doubt mental health and mental illness play a major role in suicide attempts. Therefore, using the Community Preventive Service Task Force or the CPSTF recommendation at local clinics and hospitals of using collaborative care in the management of depressive disorders can lead to improved routine screenings and diagnosis, increase provider use of evidence-based management for the diagnosed disorders, and improve the overall clinical and community support for the patient's engagement in treatment of their disorder. The collaborative care will be a multi-component management approach where case managers will link their patients with primary care providers and mental health specialists to ensure proper patient education, patient follow-up, and their treatment plan in terms of their mental illness. When we look at the proposed evaluation in knowing how our interventions are working, a short term will be increased knowledge by these young girls on mental health issues and how mental health can lead to suicide attempts. Another short term goal will be increased attitude towards seeking help for mental disorders. And finally, increased number of referrals for young girls experiencing mental health issues to medical providers. A medium term goal or evaluation is increased use of 24/7 suicide prevention lifeline that's going to be in place, better identification by school staff on signs for suicidal young girls, and increased numbers of young girls seeking proper medical help for mental health illnesses such as depression or anxiety, improved clinical and community support for patient engagement in treatment of mental disorder, and finally, better management of mental health condition by young girls due to increased interactions with medical providers and psychiatric services. And finally, when we look at the long-term evaluation, you'll see results such as reduced numbers of suicides among young girls, which is the ultimate goal, and an increased community awareness and support around mental health issues. What are some of the potential challenges or barriers that we could face? Well, when we look at the social ecological factors, people living in remote rural areas where access to mental health services are limited is definitely a challenge. Family history of mental illness or substance abuse history is a big one, potential challenge. And so what solutions can we propose to overcome these challenges, to overcome these barriers? Well, one, for people that are living in remote or rural areas, we can have this mobile outreach or satellite clinical services where we can try to reach to these young girls in time of crisis, so making sure that they're aware of the resources available to them, and then also having support group for them in their school or their social circle in case when they have family history of mental illness or substance abuse history. So these are some of the ways we can overcome these potential challenges. Here is a logic model which is based on evidence-based practice, where you have inputs such as local community health workers, educators, and then activities where you have established 24/7 suicide prevention lifeline with trained staff to handle emergency situation, and then the participation is definitely among the young girls. Another input is administrative management staff, community volunteers, medical experts, medications, of course, the medical case managers, hospital support staff. And then, if you look at the outputs, again, providing mandatory training to all school personnel that are in contact with students to ensure awareness of the signs of suicidal risk and mental health disorder, promoting collaborative care approach. And then the participation is going to be through school staff as well, also through different local community organizations, medical providers. And then, once again, these outputs are going to lead to our outcomes, which are the impacts, short-term, medium-term, and long-term, which we just covered. And the assumption here, when we look at this logic model, is that young girls who take part in the community and evidence-based practice intervention services will have improved overall mental health and reduced chances of suicide attempts. And then the external factors, of course, are the cultural practices or religious beliefs, social ecological factors such as living in remote rural areas and having family history of mental illness or substance abuse history. So this is a great way of seeing how our interventions will have a short-term, a long-term, and also a medium-term goal, if you will, in better management of mental health conditions by young girls due to increased interactions with their medical providers and case managers, psychiatric services. And of course, the long-term goal here, once again, is making sure there's reduced number of suicides among students, among young girls, and having a support group where community is very well aware and supportive of these mental health issues such as anxiety and depression leading to suicides. And here's a reference slide. Thank you very much for your time. Have a good day.